Do threads work? Let's take a beach walk and talk about this a little bit more. So, threads are barbed sutures that are placed just deep to the skin in the subcutaneous or fatty tissue layer, and they are used to pull up some of those superficial tissues and give the appearance of a lift. They're often marketed as an incisionless facelift or results of a facelift without any downtime. All things that sound too good to be true, probably because it is too good to be true. But it's worth unpacking. Do threads do anything? How long do those effects last? And can they cause more harm than good? So, threads are effective as a barbed suture. I will give them this. They go in that subcutaneous tissue and they can give a lift of just the volume. They do nothing for skin and they do nothing for areas where there's fixed ligaments. So smile lines, marionette lines, skin down here, which is fixed by the ligaments that we release during a deep clean facelift. You're not going to see much of an improvement in those areas because the thread's just pulling. It's not going to release them. And so it just really changes volume. That change is most notable in younger people and people who probably don't need much lift, and just changing the volume can really change the face structure. Once you start to get skin excess, which is most people with normal facial aging, the threads are going to be less effective because threads do nothing for skin. And so if you have a bunch of skin under your chin, you do a thread lift and they pull it up, you're going to end up with a pucker up here. And they're going to tell you, oh, that's normal. You just massage that pucker and it'll eventually go away. And yes, it will eventually go away. But when you release that pucker, all your volume is going to also fall down too, because there was nothing done to the skin. And so for most people, the result they see from threads is very minimal because it doesn't really address all the underlying issues with aging. Other things about threads. So, do threads cause harm? We need to unpack what kind of threads we're talking about. I have lived through all three recent iterations of threads. And the first threads that were placed 15 to 20 years ago were actually a metal cable. They were called an eye guide, which they were wrapped around the front of the platysma. They were anchored back behind the ears. They actually created a pretty good lift, but they resulted in leaving a wire or cable essentially buried under the skin. And those almost without fail eventually worked their way to the surface or caused little non-healing places on the skin and needed to be removed. The second iteration of threads were the barb suture sort, but they were permanent. And so when you place a permanent suture or a permanent anything really, just superficial to the skin, especially the skin of the face, which is fairly thin, it's going to extrude. And so what would happen is these threads, whether it was immediate and they weren't placed deep enough, or whether a few years passed, they'd come up to the surface and they'd extrude, they'd form blisters. I have taken so many of those sorts of threads out. Those are hopefully no longer placed. I don't think they're placed in the US. But they caused a lot of disfigurement, a lot of skin damage, a lot of deeper tissue damage if they get infected. The newest sort of threads are fully dissolvable. They're made of a substance called PDS, which is a suture material. Actually, I love PDS for my rhinoplasties because it doesn't create much inflammation, it doesn't create a lot of scar tissue, and it pretty reliably dissolves by 3 to 4 months. It says 3 to 6 months on the packaging. I feel like around that 3 to 4 month mark, it's pretty much run its course. So the barb sutures are made of this material that really doesn't last all that long. By doing that, the issues with extrusion and disfiguring the skin are reduced a lot because they dissolve before they have a chance to actually do anything. So I think there's less complications with the recent threads, but the flip side is the result you're getting is 3 to 4 months, certainly no more than 6 months. And that suture that's being placed, they may say, oh, well, you get some permanent improvement from the scar tissue made by the suture. That suture is intentionally made not to create scar tissue. So you're not going to see a permanent improvement from a thread lift. And the result you're getting from the modern threads, which have fewer complications, are going to be very short-lived. So for the vast majority of patients with any sort of aging face issues, any sort of skin excess, a thread is not the best option. And you're better off taking that money you'd spend on a thread lift and putting towards an eventual facelift or more definitive procedure. So that is my talk on threads. Thank you for coming on this beach walk with me. If you have any other questions or topics you'd like to see me cover on one of these beach walks, please leave them below. Bye.